Hello, my name is Charmaine Moyo and I'm going to talk to you about macrovascular complications related to diabetes. What does macrovascular mean to begin with? It means large blood vessels that lead to the heart, the brain, or the legs. I'm going to concentrate on one complication, which is peripheral artery disease. What is peripheral artery disease? It is narrowing of the arteries in the extremities, specifically the legs, and this causes shortage of blood flow and lack of oxygen and nutrients to that affected limb. What are the signs and symptoms of peripheral artery disease? There's leg pain that gets worse when someone is walking or when they're mobile, but it gets better at rest. Skin ulcers and wounds that take long to heal. The skin turns bluish in the affected area. There's poor nail and hair growth in the affected area. And the skin in the affected limb gets colder compared to the other limb that's not affected. Late complications are infection that leads to gangrene and then amputation. It is important to know that by 2015, over 155 million people worldwide had been affected by this condition, by this complication. And there had been over 55,000 deaths because of this. What causes this, or what are the risk factors? There's smoking, uncontrolled diabetes, uncontrolled blood pressure, and high cholesterol, which is fat. How is this diagnosed? You go to your doctor or the podiatrist, and the podiatrist is the foot doctor. So they will check the blood pressure in the ankle of the affected limb and then compare it to the arm blood pressure, and a diagnosis is made. So how do you reverse or manage this problem? One is you need to quit smoking. You need to be active. That means you need to exercise as tolerated and as prescribed by your doctor. Manage your sugars, and this is through knowing your numbers. So you need to test your sugars so that you know how to manage yourself. Knowing your blood pressure readings and being able to interpret and manage your diabetes, your blood pressure. You also need to eat healthily, lose weight, and as a last resort, or in some cases, people then go for surgery. So it is important to always look at all these risk factors and manage them accordingly so as to avoid getting these complications. Thank you.